Hello, my name is Julia and I'm going to be your nurse today, and if it's okay with you, I'm going to be doing a head-to-toe assessment. Can you give me your name and date of birth?
Enrique Capitola, July 24th, 2002.
Okay, can you tell me what day of the week it is?
It is Saturday,
What year it is?
2020.
And where you are?
At home,
Okay, so you're awake, alert, and oriented ×3, and your Glasgow Coma scale score is a 15 because your verbal, eye, and motor movements are all intact. So I'm just going to be assessing your eyes now. So just look straight ahead. Okay, so your pupils are eagle, round, and reactive to light accommodation. So now I'm just going to be assessing your cardinal gaze, so keep your head straight and follow my finger. Okay, so your extraocular movements are intact. So I'm just going to be assessing your mouth now, so I can open your mouth. Okay, your mucosa and tongue are pink and moist with no lesions, all teeth are present, and uvula rises in the midline. Okay, so now I'm just going to be listening to your lungs. Okay, so your lungs sound clear. Oh, and do you have any cough or shortness of breath? No, okay. So now I'm just going to be assessing your radial pulse. Okay, so your radial pulse is 82 beats per minute, and your respiratory rate is 12 breaths per minute. Okay, so now I'm going to be listening to your apical pulse. Okay, so that was 80 beats per minute, and now I'm just going to be palpating. Okay, so your apical pulse is palpable. So now I'm just going to be listening to your heart sounds, starting with the aortic. And with the valve too. Okay, and now I'm going to be listening to your pulmonic. And with the valve too. And then your tricuspid. And then your mitral. Okay, so now I'm just going to be palpating your carotid arteries. So they're palpable bilaterally, and the rhythm is equal bilaterally. I'm just going to be listening to them now. contracting your abdomen. So can you lay down? Okay, so there's no discoloration, no scars, no lesions, and the contour is normal. So now I'm just going to be listening for bell sounds. Okay, bell sounds are present. So now I'm just going to be percussing. Tiffany throughout all 4 quadrants. So now I'm just going to be doing a light palpation. Okay, there was no tenderness, so now I'm just going to do a deep palpation. Okay, so no tenderness, and now I'm going to try to palpate your liver. And it is not palpable. So you can get it now. Okay, so their temperature is warm, there's no discolorations, no scars or lesions, so I'm just going to be assessing your brachial and radial pulses. So they're palpable bilaterally and the rhythm is normal. Okay, so now I'm just going to be testing your capillary refill. So can I just like this? Okay, so capillary refill is less than 3 seconds, which is normal, and I'm just going to be doing. So on your lower legs, there's no scars. Temperature is warm, no lesions. There's no edema, and hair growth is present. So I'm just going to do capillary refills on your toes. Okay. Less than 3 seconds bilaterally. Okay. So now I'm just going to be doing your pulses on your feet. So this is your dorsal, that is pulse. Okay, then your posterior tibial. Okay, so they were palpable bilaterally, equal bilaterally, and the rhythm was normal. Okay, so now I'm just going to be assessing your strength. So could you grip my hand? Okay, and then grip my other hand. Okay, so your strength is equal bilaterally, and then when you put your arms like this, and I'm going to push and you push towards me. Okay, now I'm going to pull and you pull towards you. Okay, so your strength is equal bilaterally. Okay, now I'm just going to be doing the same thing with your legs. So I'm going to push and you push towards me. Okay, now I'm going to pull and then you do. Okay, so your strength was equal bilaterally, and now I'm just going to be assessing your patellar reflexes in both of your legs. So, okay, so the reflex is intact bilaterally. Now I'm going to do your bicep reflexes. So, like this. Okay. Okay, so your bicep reflexes are intact bilaterally, and that's the end of the assessment. It was nice meeting you.
You too.